Hi, Dr. Ashley here with the Allergy and Asthma group of Galen. Today I wanted to talk about hives. Now, the medical term for hives is called urticaria. Most people, including other physicians, think that urticaria or hives is an allergic reaction. However, most people would be wrong, with a few caveats. When hives or urticaria is occurring out of the blue or spontaneously, it is almost certainly not actually an allergy. Because most people think it is, we as allergy specialists have to be the experts in this rash. And so it's very common. About 30% of people at some point in their life will break out in hives out of the blue. We call that diagnosis spontaneous urticaria or idiopathic urticaria, meaning we're not sure what exactly causes it. There can be certain triggers. In children, one of the most common triggers is sickness or having a viral or bacterial infection. So you may notice that younger children will break out in hives either before, during, or shortly after they catch a cold or have an ear infection. A lot of times the medication they take for those things, such as amoxicillin, gets blamed for that rash. However, it's usually just the spontaneous urticaria with an infection being a trigger. Other triggers can be stress or anxiety, non-Tylenol pain medications such as opioids or NSAIDs, hot environments or increases in body temperature, and there's even some more odd ones like vibration of the body. Pressure against the skin is also a common trigger. Hives can be a part of an allergic reaction, but it tends to be very apparent. Think of the kid in the movies who eats a peanut and all of a sudden he's covered in red hives from head to toe. And there are usually other symptoms going on like swelling of the throat, trouble breathing, vomiting, diarrhea, and low blood pressure, and he needs to get to the emergency room. That part of hives is an allergic reaction, but it tends to be very apparent. If hives are coming up out of the blue, again, it's usually not an allergy. Well, what's going on then? Deep in your skin, there's some cells called mast cells, and they're releasing a chemical called histamine into the skin. When histamine's released in the thick areas of the skin, such as the arms, legs, torso, neck, it will cause this red, itchy rash that sometimes looks like a mosquito bite. That's the urticaria or the hives. Now, sometimes it's released in the thin areas of the skin, like the lips, the eyelids, the hands and feet, and that will cause swelling. So a significant amount of our patients that are dealing with hives also have swelling associated with it. And so you can imagine if you're covered in hives and your lips are swollen, it seems like an allergic reaction. However, usually that is not the case if it's just happening out of the blue. Most people, by the time they come see us, they've racked their brains thinking, is this something in the environment? Is this a soap? Is this a food? Is this a laundry detergent? And I tell my patients, stop. Don't rack your brain because you're not going to figure out why this is happening. We can try to identify some triggers, but ultimately we don't know. That's why the diagnosis is called idiopathic urticaria. The good news is we do have very good treatment options for this. We usually start with high doses of antihistamines. Those are typically used for allergies such as Zyrtec and Allegra. And so a lot of people think I'm crazy when I say this isn't an allergy, but we're going to use Zyrtec to treat it. The trick is it usually takes more to treat urticaria than it does allergies. So it's not uncommon for us to double, triple, or even quadruple the dose of these medications in order to get our patients' hives under control. However, it can be miserable, and we understand that, and we want to help find you the best treatment option to get you some relief. And so please come in to see us if this is happening for you. Another thing I should add is that maybe another doctor or another healthcare professional has said you need allergy testing because of this. However, in most cases, again, this is not an allergy, and so our allergy testing is actually not very helpful for this. Now, talk to your doctor. There are different individual cases where I do order some labs for my patients or do recommend some allergy testing. However, for the most part, no lab test, no allergy test is going to tell you why you're spontaneously or out of the blue breaking out in these hives. Anyways, we hope this video has been very helpful for you. Take care.